talk about was something that's probably a little bit controversial, something that might sound a little bit crazy to some people, but something that I wanted to share as a technique that is a really good option for a lot of people for eyelid rejuvenation or periocular rejuvenation. We talk a lot about blepharoplasty, where we remove skin from the upper lid, or where we transpose fat from the lower lid and tighten the lower lid skin. But sometimes when you do all that, you're still left with an eye that looks a little bit aged, and that's because the brows are heavy. And so for most people, as we age, the lateral brow comes down and creates a heaviness here, and this is infrabrow skin. It's part of the forehead, and it's not eyelid skin. So a blepharoplasty doesn't remove it. And so you can brighten the eyes with the blepharoplasty and remove the excess skin, but you might still feel like there's heaviness here. And the way to deal with that is a brow lift. And there are many different types of brow lifts. The simplest one would be a temporal brow lift, which is what most people only need. And that's just a little incision at the hairline here, and we lift the brow up so that it opens up the outer aspect of the eyelid. A temporal brow lift, we do it in the operating room because you have to release a lot of ligaments and attachments, and that would be very painful to do under local anesthetic and uncomfortable. So we put you to sleep for it. It's not a long surgery, but that helps lift up the outer aspect. You can also do a combination of different kind of total brow lifts. Classically, a trichophytic brow lift where you go along the hairline and you lift everything up, or an endoscopic brow lift where we're making incisions in the hairline and we're lifting things up. And to do that, you need to actually anchor into the bone, the scalp, as you move things back. And so there's different things you can use, like endotines. Right now, what I've been enjoying is the Sonic Weld system from KLS Martin, where we put a little lactic acid pin into the bone. It dissolves with time, but that pin holds a suture down and lets things stay up. It gives a really natural result. And then there are the very aggressive old school brow lift, which is a bicoronal, where you make an incision right across the head and you remove a strip of skin, you pull it back. I don't know anybody that really does that. That's a little bit too aggressive in 2024 to achieve what we're looking for. But where I have found a little niche in brow lifts for some patients is the simple brow lift done under local anesthetic, which I do very often for facial paralysis, which is a direct brow lift. And so if somebody has a nice full eyebrow and they have a low brow and they want it lifted and they don't want to have a general anesthetic, then you can actually make an incision right along the hairs of the eyebrow and remove the skin right above it and lift the brow up directly. That's why it's called a direct brow lift, and get a really natural result. You have to be willing to have an incision here, which will become a scar as it heals. And that process goes from a red line to a pink line to a white line, and requires a whole bunch of laser. But this heals really, really well for the vast majority of people into a barely visible scar. If you have a dense eyebrow hair, it just gets hidden by the eyebrows. If you're into microblading and you microblade the area or tattoo the brows on, it'll disappear. That's a really good option for some people to rejuvenate their eyes. If they're not a good candidate for general anesthetic, or they don't want a general anesthetic, you can do a direct brow lift with a blepharoplasty and rejuvenate the eyes. So here's a couple of examples of what this looks like once it's healed. And I think it looks really beautiful. The scar is scary for most people when we talk about it, but when you see the final result, it actually looks really natural and the scar hides really well. So maybe you're thinking about a brow lift or some eyelid rejuvenation, eyebrow rejuvenation, and this might make sense for you. It's worth a consult, worth talking about to see if you would actually benefit from it. And that's a direct brow lift, not really commonly done in aesthetic surgery, mostly done in facial paralysis surgery, but is definitely an option for some people with really great results. Everybody have a great weekend.